Hi, today I want to inform you of how suicide is affecting us in our day-to-day lives. How often do you hear of suicide? Or how often do you know somebody who passed away from suicide? It's not something that's always known, and it's not something that people always pay attention to or care about. Unfortunately, if people just paid a little bit more attention and cared for these people, it's less likely that they would do that. So, to start, I just want to inform you of what suicide is. Suicide is basically ending your own life to end any kind of pain or suffering that you're feeling. When you're doing this, it's actually a mental illness. So the person who is committing suicide, unfortunately, they do have a mental illness. Basically, the mental illness is depression. That's the biggest part. If somebody is too depressed or doesn't have the support when they are depressed, they may go to suicide. When this happens, the person usually doesn't have any kind of support or anything like that like they should. It's also nice to know that you have somebody there. Going through your life, you hit some maybe down points, a low part of your life, something that's really upsetting, but a lot of people wouldn't choose suicide. These people go right to suicide. They think that this is the best option, unfortunately, and that's part of their mental issue, is that they think that this is what's going to fix it. They really think that it's just going to go ahead and fix their pain or suffering, but it's not. Now that we know what suicide is, how can we prevent it? Preventing it can be as simple as just being there for somebody, talking to them, trying to support them in every way possible. So if you know somebody who you think is depressed, maybe even somebody that you know is on depression medication, you know that they have depression, family has a history of depression, or anything like that, you always want to try and be there for that person, so that way they don't think of anything like suicide or ending their own life to relieve pain. One thing you can do is look at the signs. If somebody is really sad, sleeping a lot, maybe just kind of not really wanting to go to work or do anything like that, they may be thinking like that. You also want to listen to what they say and how they act. A lot of people who who think about suicide don't actually do it. You have the people who will outright tell you, "Oh, I'm going to kill myself." But those people actually don't perform the action. The people who are really quiet and depressed and don't tell anybody about why they're depressed and things like that are the people that normally do harm themselves. So you always want to try and be there for the person if you think that something like that is occurring. The other thing that you can do is try and get them help. Help is a really good way to prevent this. They may not want to get help, but you have to try and convince them and try and be there for them through it. Even if you have to go to the appointments with them, that would be a great help, because then having somebody to talk to that doesn't know the situation, a professional, it can really help. They can even get on medication for it, depression medication and other kinds of medication, to hopefully kind of get rid of those horrible thoughts that they have in their head. You also just want to make sure you know the signs. If you feel that somebody's depressed, try to just research it a little bit. Research suicide, research how it happened, who does it, why they do it, the feelings that they have, things like that. Because if you can do that, you'll know the signs if you have a friend who may also be thinking about doing that. So now we know how to prevent it, but how much does it really affect us in the day-to-day life? As I said before, a lot of people don't realize that it's affecting us, but it really does. It's the 10th leading cause of death in the United States. So that means that there's other things in front of it that cause death more often, but this is one of them. So it's a really big factor, especially since it's in the 10th spot. It's a big factor of how we lose lives every single day. The other thing is it affects 43,000 people per year. So we're losing 43,000 people to suicide because they feel that they don't have anybody there to help them or don't have the support that they need, things like that. The other thing is it actually affects men more than it affects women. Women will claim that they're going to do it a lot more than men do, but when it comes down to it, men actually complete the action the most. So men, usually teenagers, but even they say in around the 20s, mid-20s, that's the most often that people do it, is around that time they feel depressed, they don't think that their life is going anywhere, so they take that route. Unfortunately, like I said, that's not the best route, and it definitely can be prevented as long as they have some good support. In closing, when I began, a lot of you didn't know what suicide was, but now you do, and you know how to prevent it. I would just recommend that if you know anybody who you think may be doing this or anything like that, definitely try to help them and get through it. So that way we don't have to lose anybody. Maybe we can even get the average rate to go down of how many people actually lose their lives to suicide. Thank you.